Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 5 minutes after 11 o'clock. I don't blame you if you don't want to call in to ask a question for the next subject, because the next subject is an embarrassing subject. And, you know, people might recognize your voice. Just guessing.
This is a necessary.
Just guessing. I would have a hard time calling in on this one. Yeah. But I want you to listen, because this is really serious and this is really helpful. You are going to be glad you heard this next interview if you are dealing with incontinence. Oh, there you go. Now you know why I said what I said. Dr. Doug Moffett is on the phone. He's an obstetrician and a gynecologist with Lake OBGYN Associates of Mid-Florida. And he's talking about Consortia Health. And if you're looking at the streaming video right now, I put their logo on there. Pretty logo. Let's look at that. Nice. Mm-hmm. The Pelvic Wellness Program. It's a natural approach to treating pelvic floor disorders that can cause incontinence and other health issues as well, right?
Chronic, yes.
Good morning, Dr. Moffett. It's an honor to have you on our show.
Yes, my pleasure. Good morning.
And where are you? You're in mid-Florida somewhere?
Yeah, we're in Leesburg, Florida, and Villages. We have a couple of different offices, so it's just Central Florida.
Well, that's perfect for this listening audience, because sometimes we speak to doctors all over the country, and, you know, everybody's interested, but it's kind of hard to get there. So you're right here.
Yes, we're in the middle of it.
All right, excellent. So am I right? I mean, this is an uncomfortable subject for most people, right?
Yeah, absolutely. It's amazing how much people kind of cover this up, but it is an incredibly widespread problem. They estimate that about half of women will really regularly have problems with incontinence. Less so in men, about half as much, but still a problem even for men. And there's urinary and fecal incontinence that they are challenged with. And obviously the social stigma that comes along with not being able to control those can be incredibly disturbing and really impact the quality of life of people tremendously. So when you have a treatment like what Consortia Health provides, it's remarkable the changes you make in the quality of lives that these people can then lead.
The fact that it is embarrassing, does that usually mean that you don't see them until it's gone on for longer than it needed to?
You know, a lot of times, yeah, they estimate actually that most people will live with regular incontinence, the ones who are affected, for an average of 6.5 years before they actually bring it up to their healthcare provider. And so, you know, it is a regular part of all of our discussions in my office. Like I said, we treat women, but it does happen in men as well. But in women, we ask them, and it can come at a younger age because of childbearing. You know, that obviously can really affect the pelvic floor musculature. But it also is not considered normal, but it's a very common part of the aging process. As you get postmenopausal, pelvic relaxation problems can happen. Things just kind of wear out. And with the muscle laxity that happens, you find people that have problems with, you know, stress or urge incontinence with the urine, bowel leaks or fecal incontinence, sometimes sexual dysfunction where it hurts to have intercourse, and, you know, pelvic floor weakness due to a history of some kind of childbirth or injury.
Do the products that are on the market today maybe make the person delay coming to their physician, because it's like you can buy some of those pads or adult diapers and things like that and try to take care of it yourself as a Band-Aid?
Of course. I mean, everybody's going to try to kind of hide that and cover it up. And, you know, it starts with a thin pad, so it's not that big a deal, and then next thing you know, it's a bigger pad, and usually until it gets to the point where they're saturating these pads and going through them so much that they have a hard time even watching a whole movie, for example, at a movie theater, or getting through a dinner with their friends. You know, that's usually when they come to us. And there are medications, tons of medications that are on the market that do a pretty decent job. There are hundreds of different surgeries that have been developed to try to help us stress incontinence, which is a different sort of form of urinary incontinence. But these cost money. They have side effects on the patients when they're medications. And the surgeries, obviously, there's risks involved with that. And so the PT program that we've got, that Consortia provides, takes all those risks away. And when you look at the fact, when they first came to us and we introduced it into our practice, they told us about 90% of people would respond to it dramatically. I thought they were really not truthful.
Oh, really?
They said, just give us a shot. Let us show you what we can do for the patients. and it has been absolutely remarkable. And it is first-line treatment for all
So,
incontinence.
if it's not a medicine and not surgical, what is it, like an exercise program?
Well, a lot of people are familiar with the term Kegel exercises, and that's like kind of old school where they would tell gals to sort of basically flex or clench the pelvic floor muscles, kind of squeeze the vaginal muscles off and on several times in an hour and kind of hold this sort of muscle flexion. But it's really hard to do those effectively, and it's hard to do them good enough to really make a difference. And so there's basically a machine that's got sort of a little probe that sits in the vaginal opening and in the rectal opening, depending on, again, what your issues are, that goes to a computer that runs something sort of like what we would call a TENS unit. And it basically can cause those muscles to contract at a very high and very strong rate, way stronger than someone would be able to do on their own, just kind of doing it by themselves. And as a result, they hypothesize not only obviously does it help with muscle tone and strengthening these muscles to make them work better, but they think it actually increases, neurogenic formation and, correction of nerve damage, which may even be a large part of why things don't get better. Yeah.
I can completely understand why you were doubting their 90% success rate statement. So when you tried it on one of your patients, were you did it happen? Did the fix happen quickly, or does it take a year? How long does it take?
So you know what? It's a great question. I would go in when we first started doing it every time the patients would come. And the patients, the way it's set up is they usually come for about 30 minutes once a week, and most programs are 8 weeks long. So it's 8 30-minute visits once a week. I would go in every time after the patients would leave and sort of interview them, say, how you doing? Are you having any improvement? And the first 2 to 3 weeks, you don't hear much. The patients are like, I'm not sure it's doing anything, but I'm sticking with it. The longer we've done it, the more you learn. It takes usually 4 to 5 visits before the patients start to see much return. But by the time they get done with their 8th week, it is not common for someone to not be dramatically improved. I mean, they almost all get better. Occasionally you run into people that don't. And in those people, we can talk about adding medication or considering surgical intervention or even extending the treatment with the pelvic floor PT. So, yeah.
Are these treatments covered by insurance?
Typically they are, yes. I mean, occasionally some people will have, co-pays and things to do. We always research all that before the people come and get the treatment so they know what they're getting into. But, for example, the Medicare group, it is essentially covered by Medicare. So, I mean, every now and then, like I said, you may have an office copay. Different plans have different coverage. But in general, you're looking at no drug, no surgery, no pain, 90% chance of dramatic improvement. That's pretty much going to be covered by your insurance entirely.
And this really restores the dignity back for a person.
Yeah, really.
Honestly, some of my favorite visits at the end of everybody's completion of their 8 weeks with us, I go in and we have a talk and I say, how you doing? And they are just beside themselves with happiness usually. You got to maintain this stuff. That's the big thing. And our gals teach them how to do these at home on their own. There's actually a device so they can take it with them to continue therapy at home so they, keep the gains that they've made. But I love that visit. It's almost always a happy visit. So
now I really want to clear up one thing. You mentioned that this could be for a man's problem as well as a woman's problem, but you, as an obstetrician and gynecologist, you work only with women?
Yeah, I do only women for this. We actually we're expanding Consortia's efforts right now actually into the assisted and independent living facilities because, one of the biggest problems in there are bed sores and skin changes and problems from incontinence. Most of these people have diaper funds that they have to pay for. Mm-hmm. There's an actual, what we call a tibial nerve treatment that Medtronic, a company, makes. And they treat by putting it's almost like an acupuncture needle at the tibial nerve down near the ankle. And you come in, same deal. You get a treatment over a series of weeks, and it can dramatically help that as well. Well, in those facilities, if you can do that and prevent some falls in the night or skin problems, it's a dramatic improvement for those people too. It's really in the starting stages, but we're super excited about that as well. And that's what we call a pants-on treatment, meaning you could literally, because all you're needing access to is a person's ankle, you could have a room full of 8 or 10 people sitting in there all getting the same treatment. So we're really excited about that as well.
Wow.
That's another way to treat the men.
For the listeners, I want you to know that Dr. Moffett is in the Villages. So you are close enough that if you want to see him in person, you can go down to the Villages and he will talk to you. And it's wonderful that you are close. I mean, we get some good information from doctors all over the country and the world. But to be honest, I mean, I'm always disappointed when I find out Philadelphia's not too bad. I guess people fly. Every once in a while, we had a lot of children's doctors in Philadelphia for whatever reason. In this case, I mean, you're talking to the right audience and they're close to you. We're not trying to sell anybody a book or get you to read a book. This is a good opportunity. I think I have somebody on the phone. Can you stick with us long enough to take one quick call?
Yeah, no problem.
Okay.
Sure.
Good morning. Thank you for calling and for waiting. You're on with Dr. Moffett.
Yes, thank you. Doctor, in a younger male, if he has a vasectomy early in his life, let's say when he's 30 or 40, would incontinence be a problem later on in life with that?
You know, honestly, as not being a urologist, I can't probably give you a great answer to that, but I don't think there's a big association, to my knowledge, with vasectomies and incontinence in men.
Okay.
To my knowledge, I don't think they're really connected.
All right. Can I give the listeners enough information so they can get a hold of you?
Absolutely.
All right. Help us with that. What should they do?
So you can either hit our website. Again, it's Lake OBGYN Associates of Mid-Florida, or you can call our office. We have an office in Leesburg, and we have an office in the Villages. Our phone number is 352, that's the area code for both, 787-1535 for Leesburg, and our Village office is 259-5649. Again, both the Villages.
Oh, my gosh. Okay. And we have recorded this. We'll put this up as a podcast on YouTube and Facebook. Please, if you know somebody that is going through this, I know it's probably embarrassing, but share this with them. And like Robin said, the dignity comes back. And, oh, my gosh, your life, your quality of life improves so much when you can fix little things like this. It's not a little thing. It's a big thing. Dr. Doug Moffett, thank you so much for what you're doing. Give us a great segment today, too.
Yeah, thanks for the call. My pleasure.
All right, we will be right back.
Get it for less at the DIY Home Center outlet. Get top quality real wood cabinets the same or less than the big box stores are selling the cheap